A silent massacre. That's what many in Italy are calling the crisis in nursing homes. Across Europe and North America, care centers for the elderly have borne a heavy burden during the coronavirus pandemic. A recent report from the London School of Economics suggests that in many European countries, nearly half of the pandemic deaths have been in nursing homes. U.S. government records also show that a shortage of medical supplies and lapses in management have fueled the spread of COVID-19 in care homes. But Turkey has been an outlier when it comes to treating the elderly. The WHO recently praised Turkey for the measures it's taken at nursing homes to contain the virus. The organization says adequate medical supplies and quick response times have led to comparatively fewer deaths among senior citizens. To discuss how Turkey has managed to protect the elderly, I'm joined from Ankara by Irshad Ali Shaikh, the health security lead at WHO Turkey. Also in Ankara, we have Meltem, Gulhan, Halil, a professor at the Hacettepe University's Faculty of Medicine and a board member of the Academic Geriatrics Society. Meltem, Irshad, welcome to Straight Talk. It's good to have you here. So, Irshad, you have spoken positively about Turkey's fight against the COVID-19 at nursing homes. The WHO even now considers compiling a report on Turkey's measures. Tell us about the steps taken for citizens in Turkey way before the outbreak.
Thank you very much. What we have suggested was to develop an evidence basis of what Turkey has done. In terms of mortality, it has been relatively low, whereas testing has been very good. So the deciding factor has been one, that big luck and vigilance. The outbreak came here 3 months after it started, so there was an ample chance to understand, prepare, and be ready. Second, by the time outbreak arrived here, we knew that the age group at the highest risk is elderly. So that warning had also distilled in seemingly with the decision makers and policy makers and healthcare providers here. But the most important feature was I think in Turkey, the testing capacity. The bottleneck that challenged such services in other countries was not present here. So we were able to seemingly identify the people who were positive, isolate and quarantine and track their contacts. Secondly, for elderly, there were vertical interdictions seemingly. So we had only those who were at high risk, serious social distancing, while the rest of the society continued to work.
Yes.
Demographically, only 8% of Turkish population is 65 and above. Last factor, I would say, is the family values. The family support system for elderly is different than other European countries.
Yeah, we're going to get into that. Yeah. Yes. Meltem, nearly half of all pandemic deaths have been in nursing homes, both in Europe and the United States. Luckily, we didn't witness such a crisis in Turkey's elderly care centers. What it has done differently, what kind of protocols were applied at nursing homes?
First of all, our Minister of Family, Labor and Social Services had taken early precautions and early preventive strategies for the nursing homes. I think these strategies result in a fewer number of infected persons in nursing homes. We have very few number of infected persons regarding or comparing with other European or American countries.
Yeah, so as just Irshad mentioned, is there a cultural aspect to Turkey's success in this? I mean, because there don't seem to be that many nursing homes in Turkey when it's compared to Europe and the US.
I think we have very organized nursing homes because most of them are in the control of our Minister of Family, Labor and Social Services. And at the beginning of the pandemic process, they make very preventive and strategies, and these preventive strategies resulted in good results, I think. Also, I think Turkey is one of the best organized country in the world regarding this pandemic process, I think, because both Ministry of Health and other stakeholders presented a very proactive management according to the recommendations of scientific committee.
Yes.
therefore, from a geriatrician perspective, I'm very glad to observe a positive discrimination in this period, because early application of lockdown for the geriatric population prevented this group from the infection.
Yes.
Also, our social health care system presented the whole diagnostic and treatment options for the whole population without any age discrimination. And as you know, our health insurance system covered the whole diagnostic and treatment process without any age discrimination. I think this is a very good advantage for our country.
So, Irshad, what were some of the missteps European countries and the United States did in taking care of their elderly? We've been talking about the shortage of medical stuff. Is that it?
No, I think other factor was in US precisely, even from the start till today, is the lack of testing. They have not been able to test all that they should and they must. And they're still trying to play catch up despite the fact that the outbreak has been there for a couple of months now. In Italy, other places, it was the speed of the spread of the outbreak. And they had over 14, 15, 16% population, not just about 65, but about 80, 85, 90 years. So by design, or by default, if I can say, the population there was at the highest risk, facing an outbreak that was new, growing exponentially. So many people were sick and reaching health systems in a short span of time. So health systems was under serious strain and did not, despite having one of the best systems in the world, the speed of entry of new patients, they were not able to cope in time. And with senior citizens, delayed care really led to poor outcomes.
Yeah. In Turkey now, restrictions are being eased and normalization will start soon. So, Meltem, is there a risk for a second wave of infection? And do you have any suggestions?
As Irshad said, Turkey has one of the lowest fatality case ratio in the world. So we have to keep it in the following periods. I think the normalization period should be implemented with the previous cautions, and it should be relaxed carefully and gradually, especially for the elderly population, because our elderly population, as presented at the beginning of the program, it's about 9%. However, it means 7.5 million elderly. And most of these patients have multiple comorbidities regarding hypertension, heart disease, or others, using a lot of drugs. So they should be very careful in this period. And I think in this period, we will be very careful, especially for the elderly people.
All right. I'm afraid we have to leave it here. Irshad, Meltem, thank you very much for joining us on Straight Talk. Appreciate it a lot.